Hello and welcome. My name is Chelsea and I'm a registered nurse here at the facility, and I also volunteer at the local community center. Today, I would like to take a look at care coordination with you all. We will review the fundamentals of care coordination and the impact it can have on patient care. I will introduce to you all the strategies patients can take to achieve their desired outcomes regarding their health, including ethical and policy issues, and resources to achieve those goals. Please follow along, and I will be happy to address any questions you may have at the end of the presentation. Many of our patients here at the facility have complex chronic illnesses which require interprofessional collaboration from different providers, possibly from various settings, which introduces the idea of care coordination. Collaborating authors stated that care coordination is an interaction between an interdisciplinary team to facilitate effective care for a patient. The authors further explain care coordination by highlighting it involves sharing patient information within the team of professionals caring for the patient to better understand their individual responsibilities to provide the best care. The purpose of care coordination is to help patients manage and receive effective treatment by sharing their health information to all providers necessary. In order to achieve successful care coordination, we must have the appropriate resources and that effective communication amongst those involved in the patient's plan of care. Next, we will discuss effective evidence-based strategies to achieve desired outcomes. Patients often are having to deal with multiple doctors and office visits depending on the severity of their diseases, and communication between those providers is not always noted. A strategy to help achieve more effective health care is having the patient be more involved in their care and self-managing. Doctors and nurses should be encouraging and supporting their patients to self-manage their care to the best of their abilities. Collaborating authors describe self-management as an individual managing their symptoms, treatment, physical, and psychosocial needs. In order to achieve this, the patient must first be willing to learn and take the initiative to participate in their care. In order for healthcare workers to promote self-management, it is important to build that rapport with your patient. Collaborating authors further discuss patients' willingness to be involved with their care was greater when they had trust within their provider. Once the willingness and readiness of the patient is established, an interprofessional team will create a care plan specific to each patient that can be involved with resources and education provided to support that patient. A patient's engagement involves motivation and access to resources with trust and support of their healthcare team and family, friends, and other support system behind them. Providing education to the patient includes an understanding of their illness with relevant, evidence-based educational resources, and it must be given to the patient to show proper self-management tips and treatment options. Having accurate information helps build confidence within the patient, and the providers can feel a sense of ease knowing the patient understands what needs to be done for their health. Next, we will discuss change management that affects the patient's experience. In order to successfully implement change in an organization, change models should be put into place. Nursing-focused change models are intended to focus on patient care by identifying barriers of care and then creating interventions to improve patient experience and satisfaction. In the last 20 years, nurse-led evidence-based models have changed to give a variety of outcomes, in an effort to increase healthcare efficiency. With healthcare ever changing, changes are constantly made in hopes to improve patient care. It is important for patients to provide feedback to hospitals, clinics, and facilities to show how their experience with that organization was. Patients' feedbacks provide factual and reliable results from their own experiences. With those results, appropriate changes can be made in order to advance healthcare. Next, we will discuss coordinated care plans based on ethical decision-making. A framework for nurses to apply in their ethical decision-making is known as the Code of Ethics for Nurses. There are 4 main principles within this framework: autonomy, beneficence, justice, and non-maleficence. Collaborating authors defined autonomy as the patient having the right to make their own decisions. Beneficence is defined as the nurse having the patient's best interest in mind. Justice defined as providing equal care to all patients, and non-maleficence as to not cause harm to the patient. This code of ethics applies to all nurses in all settings of healthcare. Within the Code of Ethics, there are different provisions to review. One important provision within the Code of Ethics I would like to discuss with you all, created by the ANA, is the patient having the right to choose and refuse health care. Self-determination by the patient, and potentially the patient's family members or loved ones, is a principle that must be respected and upheld in healthcare. Nurses hold a level of responsibility in allowing the patient to accept, delay, or refuse any treatment with the proper education on benefits and consequences in the matter. Nurses must respect and ultimately follow their patient's request in assuming it will not cause further harm. When coordinating care, the nurse and providers, along with the patient, make decisions and opinions that may not be the same, but it is the responsibility of the nurse to commit to providing care within the 4 main principles. Next, we will discuss the impact of healthcare policy provisions on patient experiences. As we have discussed, care coordination has its challenges due to the complexity of illnesses and patients' needs for multiple providers. In 2010, a law was put into place to help healthcare and patient outcomes overall. The Patient Protection and Affordability Care Act was signed by President Obama in hopes to enhance care coordination and improve patient outcomes. The ACA, better known as Obamacare, was created to help uninsured Americans by lowering the out-of-pocket healthcare costs. This allowed many Americans to be eligible for Medicaid and the right to affordable health insurance. This resulted in a positive impact on patients' health by allowing people to receive health care regardless of their economic status. Next, we will discuss the nurse's role in care coordination. The nurse's role in care coordination is critical because of the time spent together and the relationship that is created between the nurse and the patient. Nurses help provide necessary resources to patients to help them manage their illnesses in hopes to improve their overall health. As the nurse, you are helping to promote the connection between the patient and necessary interdisciplinary team to effectively treat the patient in the safest manner. The nurse's involvement in coordination of care is summed up as providing education to the patients and family members or caretakers involved, demonstrating effective communication with the patient and the other healthcare workers who may be involved, and creating care plans designed for that patient's individual needs. Thank you for following along with me today during today's presentation. As the nurse, you hold a significant role in healthcare and in care coordination. Our responsibility is to uphold the code of ethics in our patient care to provide safe and quality care. It is crucial we continue to educate ourselves on care coordination and make it a priority in healthcare. In doing so, we can provide ways to improve patient outcomes. Thank you again and have a great day.